So I think, you know, one of the opportunities that the profession of nursing sees today in healthcare environment is really the ability to care for these complex patients that come through any of our doors. And so what we're seeing, particularly with the changes in the Affordable Care Act, is that we have many opportunities to care for patients in a different manner, which is good. They have the access, and we need to still strive to provide that quality care. And so from a nursing standpoint, I believe there's so many different competing priorities, to be honest with you. One example would be looking at all of the regulatory requirements as it relates to documentation. So not only unique to our organization, but we hear it from our colleagues across the country, that the documentation requirements, which we all know is the right thing to do for the patients, and we want to make sure we meet the regulatory requirements, is sometimes daunting and taking, you know, a frontline nurse away from taking care of her patients the way he or she would want to. And so it's really trying to manage all those competing priorities and caring for such complex patients in different organizations. We do a lot of different things as opposed to support, as it relates to supporting our frontline nurses. So we have what's very unique. We hired this past year a nurse practitioner who's focused on nursing wellness. And so there's many initiatives that the Cleveland Clinic has for all of its caregivers, but this is very specific to nursing. So it's really offering different strategies to decompress, looking at the mind, body, and soul, different offerings, whether it's healthy lifestyle, whether it's exercise, diet. We have a variety of different support groups for that. They got hired in January of this past year, and in fact, we had our first nursing wellness retreat last month, and I'll have to tell you, the feedback has been tremendous. So it was an opportunity, it was on a Saturday. We invited all nursing caregivers from across the health system to come and participate and listening to different speakers, vendors, really all in the spirit of trying to help them from a wellness standpoint and to do their job better. Definitely. So we've heard positive feedback from our frontline caregivers because, in their words, we really are extending that we care about them and we're showing them the value that they bring to the organization with our investment into them. With all the changes in the healthcare environment, all of our patients are becoming very complex and they need care coordination. That's really going to be the root of any success with all of this. And so what we're doing here is really looking at care coordination across the entire healthcare continuum. So whether it's at home, in an ambulatory clinic, if they were in the acute care setting and afterwards. So having those care coordinators or those navigators, as you mentioned, in the oncology area really helps have one point person be that liaison that the patient and their family can contact to help them navigate across that entire journey. Because what we've seen in the past is that, particularly in this patient population and other patients who have very complex diagnoses, is that oftentimes the care can be very fragmented and you don't have one person that you can call. So the value of having this navigator or care coordinator is that it's really one-stop shopping, and they can really ensure that it's two-way. You can reach out to them and they can reach out to you to make sure that you're on track where you need to be. So I think there are many opportunities. So when you look at the Institute of Medicine's Future of Nursing report, what it really called for is nursing to take the lead in this transformation of healthcare. So I think moving into the future, it's a tremendous opportunity. You know, there's a lot of buzzwords out there about clinical transformation or transforming healthcare, but really nurses are really the backbone in any healthcare industry. You know, we're 3 million strong. So what we need to do is take that leadership position and look at these different venues where our patients are, in home, in the hospital, in the ambulatory clinic, and be the leaders. What I see the future happening as well is really a tremendous growth with advanced practice nursing. So I failed to mention here at the Cleveland Clinic in our health system, we have 1,100 advanced practice nurses, which is very large, most of which are nurse practitioners. And it is in my opinion that we will start to see them come through our ambulatory clinics to provide that access that our patients need to get the care in a more timely manner.